You are watching Notepad. I'm your host Ibrahim Sani. Again, we continue the conversation on vaccines. If you've seen throughout the entire evening on this station from 9 o'clock, 9:30, 10 o'clock and now 10:30, we are still going to start to talk about the vaccines. And I have on the show with us Dr. Helmy Haja Mydin. He is the CEO of SERI, and of course he is also a consultant physician, respiratory specialist actually at Pantai KL. Dr. Helmy, over the weekend you hosted a very interesting clubhouse chat. More than 3,000 people attended, and Dr. Kalai, Tan Sri Jamila, and of course KJ was there, and a lot of things were discussed there as well, including Dr. Giri, if I've not missed out anybody else, CRM as well, Dr. Akmal. Okay, there you go, 6 people there. Let's understand some issues here, because the focus for this evening, for this show, is of course trying to understand the differences between anti-vaxxers versus the issues of people that are still hesitant about the efficacy and the efficiency of the virus, of the vaccines per se. And I would like to coin the term virus hesitance instead of or vaccine hesitance. That's the idea that right now we have to listen to their concerns. One of them is, of course, they claim that there's not enough information that can be found on official websites. And just before starting this show, while waiting for you actually, I was actually browsing through the NPRA website. And of course, the NPRA is a website that focuses on granting approvals for drugs in this country. It wasn't as much as clear as I thought it would be when it comes to the vaccines. Tell us, what are the main concerns of those that are a bit hesitant on taking the vaccines, and what should we do to allay these kind of concerns?
The general points that are being made are, one, the fact that the technology for some of the vaccines, so like the mRNA vaccine, for example, is very new. And as a consequence, there is a lot that is unknown about it. So there's this fear of the unknown or fear of something new. And then because it involves something like mRNA, there are in some circumstances a misunderstanding of the fact that it may or may not be part of our DNA. So there's a lot of fear with regards to whether or not the very basis of what makes us who we are, our DNA, will be affected. There are also concerns about the speed in which these vaccines have been rolled out. So there are concerns about whether or not the studies done were actually done properly. Do the results that are the results being shared are really what they say on the tin? And of course, there are concerns about safety issues, not just in terms of the vaccines in the short term, but for the long term. So one of the most common things I find in terms of comments is, how do we know what are the long-term effects of these vaccines? Now, I think it's very difficult to go through every single study and go through every single vaccine on a website, because even the Pfizer vaccine, if I'm not mistaken, there are submissions to the FDA ran into 400 or 500 pages. And you do need a fair amount of technical skills in order to understand and to differentiate the different nuances of the vaccine. It's as if you're applying to, erect a skyscraper. You don't expect the details of the blueprints and the plans and everything from the engineer to the architect to be made available publicly. You do need to have some expert opinion, because there are a lot of challenges in differentiating what's facts and what's fluff. And this is the need to communicate things in a fairly straightforward fashion. And I think this is where the challenge arises.
Yeah, again, back to communication, right? One of the bigger communicators out there on the vaccinations, again, as KJ was talking about previously, vaccinations, not necessarily vaccine, is the conversation that we need to be had right now. And of course, the communication that we spoke of is through this new organization called JKJAV, or Jawatan Kuasa Vaccine. And some of the communications I felt was sufficient, but the vaccine hesitants out there are still trying to get some grasp into whether or not this kind of information, number one, is verifiable, number two, whether or not it's sufficient. So is there a point in time when we have to draw a line in the sand and say, I've done all I can in informing you, we have to move on, we have to get the vaccinations done, and we have to apply the use of law in this instance, meaning that if you don't take the vaccination, we can take some punitive measures in one way or another against you if you fail to comply. Do you feel that this heavy-handedness measure is actually warranted? And number two, is it in fact allaying the fears that these vaccine hesitants are having in the first place?
I don't think you should be penalizing people for not taking the vaccine. Ultimately, that's a right for each individual, and it is each individual's human right, really, to accept or not a particular type of medication. One can provide ways to improve uptake, and this once again goes back to the conversation we're having about communication and education. But this is a very different category as opposed to those who are actively promoting falsehoods or mistruths. So it's one thing to say, I don't want the vaccine for whatever reason that I feel to be true, but it's another for me to go out and then to evangelize on the fact that vaccine A is going to kill someone or vaccine B is going to make someone paralyzed and things like that. Because if I'm going around essentially telling lies, then that I think needs to be looked into very, very carefully and very, very severely if necessary. You don't allow people to go around accusing an individual of things they're not doing. If I were to go out today and say that Ibrahim Sani is an ex-murderer, you're not going to keep quiet and just accept the fact that I'm going around saying that. And if I go around and say things like taking antibiotics is going to kill you, and that leads to people not taking the antibiotics and dying as a consequence of infections, then that's someone promoting something that's led to murder. So to me, I think it's not about the individual saying yes or no. That's up to the individual, and it's up to us to convince the individual of what's right. But to allow people to go around spouting mistruths without being challenged, I think that's a different category altogether. And I've completely forgotten your second question.
No, it's okay, because what you're saying is consistent with what the Minister of Health is saying today, that there wouldn't be any penalization of people not taking the vaccinations, but there will be severe action taken for anyone, including physicians, spewing untruths about the vaccine and the process of vaccination per se. Let's move on to now the conversation of February 24th. And as announced yesterday, the first two individuals would be the Prime Minister himself, as well as the Director General of Health, Tan Sri Nur Hisham. This is slightly different from what other places around the world are doing. In the UK, the NHS, however poorly that they are managing the pandemic, or at least in their own case, the crisis domestically, they made a nurse to be the first recipient. In Singapore, it's almost the same case. And of course, Jacinda Ardern, the New Zealand Prime Minister, even argued that she's not the priority here. The priority is indeed the frontliners and people who are in the risky group. Why then do you feel that in Malaysia on February 24th, just 2 days from now, 1 day from now, it's going to be the PM and the DG? Do you feel that the argument here is slightly different in terms of trying to convince other people? Or do you feel that they are truly people that needs to be prioritized when it comes to vaccination?
I think it's more the former. We are a different country from, say, New Zealand, where there are very different core beliefs. There are very different different levels of trust with authority and the state. And because of that, we need to approach things differently. We keep talking about anti-vaxxers and also those who perhaps are more concerned about safety issues. So like you coined the term, vaccine hesitancy. So these are not a homogeneous group. There are many people who view things with very different sets of facts in their mind, very different emotions. And for some of them, seeing a leader take the vaccine is going to be helpful because it will give them some degree of reassurance, especially if there are concerns about other aspects of the government. But unfortunately, if there are aspects of the government that fall short of being, if people are not if they don't believe or they don't trust some aspects of what the government is doing, then unfortunately it will spill over to other aspects, and that includes public health. So this is one way of countering that, by having the Prime Minister, by having the Director General of Health, by having muftis, by having religious scholars, maybe even royalty to get their vaccines in public. That will go a long way to assuaging those fears.
Fantastic. We'll go for a short break. When we come back, continue the conversation with Dr. Helmy. We'll be right back after these messages. Welcome back. This is Notepad. I have with me Dr. Helmy of Seri on the line right now. Dr. Helmy, throughout the entire evening, we've heard bipartisan support in this. Dr. Ong Kian Ming as well as Dr. Afif. Dr. Afif, of course, is a medical doctor. Ong Kian Ming is a PhD holder, but still both of them are very interested in trying to make this work bipartisanly. And we've heard support from Dr. Zul just before we started this show, the former health minister, talking or urging, in fact, people to understand what the situation is on the ground and trying to expect or set expectations right for the vaccination process to take place. One thing that lays into a lot of people's minds right now is on the types of vaccines that are made available, the kind of issues that made one would choose one vaccine over the other. And we've heard a lot of people explaining to the public on why there has to be no choice that is given to the public. But can we re-explain again to the public why do you think that the government chose a portfolio of vaccines and why we can't choose what we got?
It's all about availability. So at this point in time, the demand across the globe is much, much higher than the supply. So we could, for example, go to, say, Pfizer and say, hey guys, I need 60 million doses tomorrow. And they'll just shrug and say, good luck with that. We have got no supplies for you till next year. Now, do we then wait for an entire year to get that 60 million for our so-called, first choice of vaccination, of a vaccine? And in the meantime, have 1 year of not vaccinating anyone, and with that, an increase in cases, deaths, long COVID syndrome? Or do we then say, right, it's actually a bit foolhardy to put all our eggs in one basket, and let's get as many options as possible here? And that was the thinking when all the negotiations started sometime last year. You don't hope or you don't just expect one company to provide everything for yourself. And bearing in mind, we're also dealing with companies that have clients across the globe. So Pfizer is not just providing vaccines for Malaysia, they're providing it for Europe, for North America, for South America. It's the same thing with Sinovac, the other groups like AstraZeneca, CanSino, they're all dealing with multiple clients across the globe. So you don't really want to wait for just one particular vaccine to be able to get the benefits from it. And whatever happens or whatever arrives, it would have gone through the NPRA, and it would be something that would have gone through scrutiny to ensure that it is something that works and something that has got minimal side effects. So to me, that is what's important. The NPRA has gone through it. They say that this is the real deal. This is not something illegal or something that's been smuggled in or something that is all about marketing. And if that was to be offered to me, then yes, I would go for it.
There's also this argument of harking back to yesteryears when we take vaccines without knowing what it is for. We just have a schedule, we adhere to it, we have a little book that we go through, and when I had my first 3 kids, my wife was studying somewhere else. I just religiously brought the kids to the vaccination place and punched the vaccination cards, not knowing what is what. My wife would probably know because she's a doctor, but I'm just there. I'm just there for the routine thing, right? And this, of course, include the polio and all the other stuff that is completely eradicated already on the face of this earth. But why the rise of the questions right now? Why do you feel that there has to be a lot of friction that is currently happening in the society right now? Because more so today than last week, perhaps because we have the vaccines literally right in front of our eyes, than perhaps those that were not particularly following this piece of news is suddenly realizing, oh my God, the vaccines are here. There's a reality of us getting the vaccines, getting shot up in our arm. Perhaps now's the time to ask the questions. Is that the situation that you think is going through right now in Malaysia?
The science behind COVID-19, whether it's the vaccines or medication, is very complex. And not only that, there have been a lot of advancements over the past few months, and there are still a lot of uncertainties. So it is understandable that people are going to ask questions. I don't think we should penalize people for asking questions. It's only normal to want to know what it is that I'm going to inject into my body. Once again, it goes back to why do we give these vaccines to people? What are we trying to prevent here? What are we trying to reduce here? And conversely, how is it going to improve your lives when it comes to hospitalizations, healthcare utilization, opening up the economy? getting people to travel again, getting kids to school. So it's really about pushing through that very message about why we're doing things. So what you say is absolutely right. People are getting more concerned because that date in which they may potentially need to be vaccinated is drawing closer. On the flip side, there are people who are feeling that it's actually taking too long, that they want to be vaccinated yesterday, but unfortunately the vaccine is not going to be in their body till about 6 months down the line.
We all know how it attacks the body right now, COVID-19, but of course the focus has always been on respiratory system, and being a specialist in this area, do you feel that people with asthma, people like myself, would be at a greater risk of having a severe case of COVID compared to other patients? What is the risk right now of people not taking the vaccines when it comes to people with respiratory issues?
So respiratory per se, actually, interestingly, we don't see that many complications. So if you, for example, have asthma, but your asthma is well controlled, then your risk is pretty much similar to anyone else. What we do know for a fact is the fact that those who are above the age of 50 and with certain comorbidities, particularly diabetes, renal failure, and heart failure, they are in a much higher risk of complications. Now, by complications, we're talking about having a severe flare-up of the condition whilst in hospital, leading to the need for ventilators, in some cases, unfortunately, death. And even if you were to be discharged from hospital, some people leave with fatigue, with difficulty breathing, with lung fibrosis. So it's always more than just about the numbers that we see on the daily press conferences.
Okay, and the next final few minutes of this interview, I just want to focus a little bit more on how this will impact Malaysian business community. We still have to expect the private sector in particular to observe the modern day of doing things, which is work from home if we can. If we can't, continue to observe SOP. There's a lot of compliance when it comes to people in large towns, but I do see people flaunting SOPs, and it all boils down to the individual, whether or not the individual wants to continue to reduce their risk of contracting COVID-19, or they don't care, simply put. Do you feel that the vaccinations are going to change people's mindset in terms of how they have to remain compliant moving forward? Do you feel that that whole idea of people forgetting how things were in 2020 and how things were now, do you feel that that is going to not be good, I guess, for the country in the near term?
I think part of the comms will have to be about managing expectations. Now, if you look at the UK, for example, they have been rolling out the vaccines for quite a few weeks now, and there is a stabilization in the number of COVID cases. But that's more due to the physical distancing and the movement restrictions that they have in place. So even for someone, or rather a country like the UK, the real impact of the vaccination program has not been felt yet. What more, us in Malaysia, people in the community are protected, is going to be a few months down the line. So we by no means should be taking away the foot from the pedal when it comes to ensuring the right SOPs are in place, that we are still maintaining our appropriate physical distances, that we're wearing our mask, because these are the things that are actually going to make a big difference overall. We don't know how long the vaccines will last for. We don't know if the variants that will eventually come up over and over again will be similarly, what was what I'm looking for? Basically, the vaccine, will it be able to protect us against it or not? And last but not least, we are even going to figure out down the line whether the virus is going to be endemic as opposed to a pandemic. So overall, I would say that it is a tool. We have a vaccine, or vaccines rather, that is a tool in a box of tools that we need to use to protect ourselves and to defend ourselves against this virus. But it is by no means a panacea. It's not that one thing that's going to be a silver bullet that will solve all our problems.
Okay, as alluded to when we started this show, we hosted the clubhouse with over 3,000 people there. What were the essence of the conversations that took place? And if people want to find out more about the context and the content of the discussion, where do they go to?
You can go to KJ's Twitter page, actually, because he's got links there, not only to the Clubhouse conversation itself, but to various websites that will give you up-to-date information about the vaccines. The gist of the whole conversation was really pretty much similar to what we are discussing today, which is why do people need the vaccines? What are the side effects? What are the problems that we may be coming across as we move forward? And last but not least, how do we deal with skeptics, anti-vaxxers, or those who are hesitant about vaccines in general?
Fantastic. Dr. Helmy, we're going to go for one more short break, and I'm going to ask you a little bit more about Seri. That's coming up after these messages. Welcome back. I have with me Dr. Helmy Haja Mydin, the CEO of Seri. Let's talk a little bit more about Seri. How are you guys progressing along, and what would be some of the objectives that you would like people to know about?
The entire aim of the think tank from the very beginning was to highlight issues of inequality, and this is particularly in the digital space because, as you have covered in your show many times, we are heading in that direction where the nation is becoming more digital in many ways. It is a tool that we feel can do a lot in terms of bridging the gap. So, for example, we have cases of individuals who are blind. I just found out, for example, we have a blind national football team, which is doing really well, and we have technology that can help them bridge the gap and do things that they otherwise wouldn't be able to do. But on the flip side, if we have wrong policies or we have a wrong approach to things and we do not remember about the gap that's there or the divide that's there, then it can actually increase inequality. And what we're trying to do is we intend to come up.
Okay. Sorry, that was a lag there.
All
right, we'll go on. Thank you, Dr. Helmy, for spending the time to speak with us. That was Dr. Helmy Haja Mydin, the CEO of Social and Economic Research Initiative. He's also a doctor at Pantai Hospital KL. If you've missed any part of this show, just head on to Astro AWANI and learn more about COVID-19 and the vaccinations that are involved with it. Again, we continue on the conversation of vaccines and the vaccination process that will take place in the country right now as we speak. This week we'll see the first few vaccinations taking place, and there'll be more on vaccine news. Stay tuned to only with the verified information out there. Try and stave off the WhatsApp group for now when it comes to vaccines and the information related to it. Stick to the proper channels and stick to the official announcements. Until then, thanks very much for watching, and goodbye.